Hi, everyone, and thanks for joining us. My name is Katie Starr, and I am with the Standlee Premium Western Forage marketing team. Standlee Premium Western Forage is a family-owned business located in southern Idaho with ideal growing conditions to raise some of the best quality forage in the country. We're here to serve you and your animals with consistent, high-quality nutrition and offer valuable education to keep them happy and healthy. Welcome to our educational webinar titled Gastric Ulcers in Horses, What Causes Them and Proper Management. Performance season is in full swing and unfortunately increases the incidence of gastric ulcers for certain horses. Today we're going to learn a little more about what causes gastric ulcers, medical management, and some best feeding practices to help prevent them. If you happen to be new to joining our webinars, we'll take just a minute to go over a few items so you are comfortable with viewing and participating in our webinar. If you're viewing this as a recording, feel free to skip over this section. As a heads up, we will have a couple of poll questions throughout the webinar that we will pause the presentation for you to answer. We will also be giving away some free Standlee product coupons and some Ulcer Guard from Boehringer Ingelheim at the end of the webinar, so you'll want to stay with us till the end. We've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right corner. Clicking on the red box with a white arrow allows you to open and close the control panel anytime you'd like during the presentation. You're listening in using your computer speaker system by default. If you would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed for you. You will also have the opportunity to submit questions via text to today's presenters by typing your questions into the questions pane of the control panel. Please feel free to send in your questions along with which presenter you'd like to direct the question to at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. Depending on how many questions that come in, we may not be able to address all of them within our time frame, but we will certainly use them for future nutritional pieces and connect with you one-on-one if you reach out to us. We also have attached a nutritional paper associated with today's webinar and a quick fact sheet that you can download from the control panel under handouts. For those viewing this as a recording, go to StanleeForage.com under Nutrition and Nutritional Resources to find the white paper titled Forage and Gastric Ulcers, along with a quick fact sheet that you can see here on this slide. The What You Need to Know About Gastric Ulcers handout would be a great to print and laminate and hang up in your barn. You probably have your veterinarian on speed dial, but there is even a place here to write down your vet's contact information for quick access for yourself or anyone else who helps care for your horses. These are both great take-home pieces for this webinar. And that's all I have from an introductory standpoint. So please welcome Dr. Tania Cubitt with Performance Horse Nutrition and our guest presenter, Dr. Hoyt Cheramie with Boehringer Ingelheim. Dr. Cubitt serves as one of our Standlee Premium Western Forage equine nutritionists and has a PhD in equine nutrition and reproduction. Dr. Cheramie is a senior equine professional service veterinarian with Boehringer Ingelheim and has both a master's degree and board certification in equine surgery. He is an expert in gastric ulcers and has performed over 3,500 gastroscopic examinations in horses. Thank you, Dr. Cheramie, for joining us today. We're glad to have you.
It's my pleasure. Thank you.
And Dr. Cubitt, if you would go ahead and just start the presentation whenever you're ready.
Thank you, Katie. And I do want to also reiterate, I'm very glad that Dr. Cheramie has joined us this evening in our putting together of this presentation. I know you're going to get some really great information out of it. So I think every time we are going to address a certain problem in a horse, I think it's really important to set up what is normal. So we're going to go through digestive function, some basics of digestive function, so you know how it should normally occur, and then we'll transition over to Dr. Cheramie, who will talk about when that normal stomach function breaks down, talk about gastric ulcers, some of the medical management for that, and then I will chime back in with some of our supportive preventative management and our forage management, how to feed these horses that forage. And then obviously we really want you to be able to ask as many questions as you can at the end. We're both available for that. So let's go ahead and get started. And we will start with digestive function. I always like to start with this slide, with this graphic, talk about the evolution of the horse, because on the left-hand side, that photograph on the bottom, it looks like a herd of horses out there in a field eating a bunch of weeds. That is natural for horses. They eat a wide variety of forages. They're herd animals. They're grazing continually, about anywhere between 12 and 18 hours a day, and their heads are down on the ground. So that herd being able to graze continually, that decreases their stress, and they've continually got a small amount of nutrients constantly trickling through the digestive system. Some people even call them trickle feeders. The other things that occur when the horse puts its head on the ground is you get this natural drainage of the respiratory tract. It significantly increases chewing time, and we'll address that in the next slide. It prevents muscular tension in the neck and back, and also aligns those teeth properly. What we do more commonly, though, is the right-hand side of this slide, that horse in a really nice stall. But we expect our horses to live a long time and have multiple careers, and we feed them a lot more cereal grain-based diets because we know that, we've got lactating brood mares, or we've got horses at high level of performance. We need to get a lot more concentrated nutrients, a lot more calories and nutrition into them. So we are feeding a lot more cereal-based concentrates. The problem here is the management of doing that. We often meal feed horses. We feed 1 or 2 meals a day. If they're lucky, maybe 3 meals. They consume these quickly. All of this increases the acidity of the GI tract, specifically the stomach. And some horses really stress with that lack of socialization, which can also increase the acidity in the stomach. Exercise level, well, we have really 2 extremes. We have lawn ornaments and horses doing really high levels of exercise. But you'll also notice that bucket hanging on the wall. That's a pretty typical height for us to hang our feed buckets. It's got a narrow base. All of that leads that horse to be able to consume that food really quickly and then stand around and do nothing. So I'm not advocating that you go and grow weeds in your field and put all your horses out together, because that's going to decrease their stress. But simple things like feeding your horses closer to the ground, decreasing their stress, making sure they've got forage all the time so that we can mimic that grazing behavior. But just always remember, what is the horse designed to do? If we then move to the teeth, we all know that bottom jaw kind of works in a circular motion independent of that top jaw. And the graphics on the side here, I want to point out, this is that circular motion. This is taking a graph of that circular motion of that bottom jaw. When a horse is eating grain or pellets, that circular motion is much shorter. When they're eating hay or grass, that circular motion is a lot longer. So it takes a lot longer for them to chew. A horse at pasture, ad-lib access to pasture, is going to chew about 60,000 times a day. But when we put that same horse in a stall and we feed him what we would consider an ample amount of forage, 1.5% of body weight, 15 pounds for that 1,000-pound animal, we've got about 25,000 chews. Well, let's add in between 6 and 12 pounds of grain, and we've got between 28 and 30,000 chews. So that's half of the amount of chews that a horse would do if they were naturally out grazing. So that normal amount of chewing that's we need to produce saliva and buffer that stomach acid. Saliva, that's the key here. Not only when the horse chews are they masticating, breaking down the food particles, they're also mixing it with saliva. And saliva does 2 things. It lubricates the esophagus so the horse doesn't choke, but it also helps to buffer that stomach acid. And so this research actually looked at the amount of chews, or jaw sweeps in technical terms, a horse does when you feed at different heights and different forms of feed. So if we put 2 pounds of oats or grain concentrate on the ground, that horse is going to chew that about 1,000 times. 2 pounds of hay on the ground, that horse is going to chew about 2,000 times. Let's take that same 2 pounds of grain oat concentrate and put it at chest height. Now that horse is going to chew between 350 and 500 times. So we have significantly decreased the saliva production and the rate of intake. So now the horse is going to stand around with nothing to do. And as Dr. Cheramie will show, that is going to really increase the acidity in the stomach. We won't spend too much time on the esophagus, but we don't just go from teeth to stomach. We've got this in between here. We've got the esophagus, which is a muscular tube that the saliva will help to lubricate, and it's a muscular tube that will slowly push food down into the stomach. I'm going to turn it back over to Katie for a poll question, and then we'll go on to Dr. Cheramie to discuss the stomach.
Thank you, Dr. Cubitt. So our first polling question is, do you currently have a horse or horses with gastric ulcers? And the options are pretty simple, just yes or no. Your specific answer won't be seen by any other attendees, but we will go ahead and view the total responses together once the poll is closed. Okay, it looks like majority of you have voted. If you could go ahead and select your answer and then click submit, we'll go ahead and wrap up and close the poll. Okay, we're going to go ahead and close the poll now. So I want to share with everyone just so you can kind of see. So for do you currently have a horse with gastric ulcers, we had 54% say yes and 46% say no.
Excellent. Thank you, Katie, for that. It's a really prevalent problem, especially in our performance horses. And at that, I am going to turn it over to Dr. Cheramie to discuss normal function of the stomach and go into our equine gastric ulcer syndrome. Dr. Cheramie?
Thank you, Dr. Cubitt. So we'll take some time now to talk about why horses get ulcers and what can be done about them. We know about 60% of horses to 70% of performance horses will develop ulcers. That's 2 out of 3 horses. So the incidence is quite high. If we look at race horses, it even gets higher. If we look specifically at EGUS, or equine gastric ulcer syndrome, in the horse, we divide it into 2 different diseases, squamous disease and glandular disease. Those are related to specific parts of the horse's stomach anatomy, and we'll see that in the next slide. But squamous disease is going to be very similar to what people get as GERD, or gastroesophageal reflux disease. So anywhere from heartburn to esophageal erosions, we see that in people. It can happen in horses. It just happens inside their stomach, so it's a gastric ulcer. Glandular disease refers to ulcers in what we might call the true lining of the stomach. And in horses, we really don't understand the complete nature of why they develop those specific lesions. But we do know that the association is mostly with people. So we're kind of the cause. If we take a horse like Dr. Cubitt showed in a natural grazing setting, they're at very low risk of developing ulcers. When we put them in with people and we do the things we want to do with them and we feed them in the way we feed them, we put them at a greater risk. So if we look at the horse's anatomy, think of the horse as standing with its head facing to your right on the right side of the screen and its tail to the left. So we're looking in a window on the right side of the horse's stomach. We can see that the esophagus comes in from the front of the stomach, and the lining of the esophagus is the same lining as our esophagus. And that lining doesn't have much protection against acid. Think the last time you got heartburn. That's only the acid from the stomach moving into your esophagus and burning it because it's not supposed to be there, so it's not protected. Well, as you can see, for the horse, unfortunately, the lining from the esophagus extends into the top half to 2/3 of the stomach, with the glandular lining or true stomach lining covering the bottom half to bottom third. So for a horse to get heartburn and subsequently get erosions and ulcers from that acid, the acid does not have to move back into the esophagus. It just has to go from down here at the bottom to right here in the middle, and that tissue will develop an ulcer. It's also related to the horse's physiology. A horse, unlike us, makes gastric acid continuously. We only make gastric acid when we eat. A horse can produce up to 16 gallons of acidic fluid a day in their stomach. Now they need that acid, but they don't need it at extreme levels the way we do because they don't eat the same types of food that we do. Most of their digestion is going to occur in the later parts of the gastrointestinal tract. In fact, the stomach is quite small relative to the size of the horse. But as Dr. Cubitt mentioned, the horse produces a lot of saliva, and that's very important in buffering this acid. So in a natural grazing setting, the horse is constantly taking in food, making a lot of saliva, which is going to help buffer that acid so it doesn't become overly acidic in the stomach. What happens is we put horses in our management system and we take away that continuous grazing. It allows their stomachs to get empty or mostly empty, and the fluid that's at the bottom where it's not causing a problem moves to the middle where it begins to cause a problem. Stress and activity can also increase the amount of acid that a horse produces, or will help lead to a decreased fill in the stomach as well. And some of the main causes that we talk about are things that are associated with gastric ulcers in horses, you can see on the slide, from competition and training, travel, injury or sicknesses, even just that weekend showing or a weekend event puts them at risk, shown in a couple studies. But the big things are generally how we feed horses, and that limited turnout or grazing and the types of food that we feed them as well. And we'll look specifically now at what I think is the #1 risk factor, and that's feeding. And as Dr. Cubitt mentioned before, we feed horses meals, but their system's really not made to handle that. So the bigger the meal with more space in between allows those horses to end up with an emptier stomach than normal, and that fluid just moves to the top part of the stomach. Right? Also, our selection of feedstuffs can play a role. As we know, cereal grains or grain concentrates also lead to increased amounts of acid production during digestion. The second risk factor we talk about is stress. And I divide that into 2 stresses, physical stress and behavioral stress. The physical stresses are just simply the things that we do with our horse, the training, the competition, illness or layup, pain, those kinds of things are physical stresses on the body. Increase the production of cortisol, the stress hormone. One of the side effects of that is that cortisol has an effect on the stomach to increase acid production while decreasing some of the normal protective mechanisms. The second type of stress we talk about is behavioral stress. And for the most part, we were looking at hauling horses and stall confinement, social regrouping. Those things we know also increase the stress level in the horse and can have the same effects of increasing the level of acid in the stomach, as well as decreasing the normal protective mechanisms. The typical signs that we see associated with gastric ulcers have been talked about for many years now. The first 4 on this slide, weight loss, reduced appetite, poor hair coat, and recurrent colic, are probably most often associated with chronic or long-term presence of gastric ulcers. However, when a horse first starts to get gastric ulcers, and it may continue throughout while they have them, we can often see attitude changes, generally for the worse, and poor performance. And this has to do with, think of having heartburn continuously and then being asked to go out and exercise. But also, we know that the pain created in the stomach from the ulcers physically inhibits the horse from being able to move as naturally as they would. And in fact, in one study, it showed that horses with ulcers had a 2-inch shorter stride length than horses without ulcers. And so you can see that physical effect decreases that horse's natural performing ability. They just can't move as supple and as free as they would if they didn't have ulcers. Now, how do we manage gastric ulcers? We're going to talk about treatment first, because that's our goal. If we identify ulcers, and we do that by gastroscopy, so it's a procedure where we take a flexible tube with a light and a camera on the end and pass it like we would a stomach tube, and we can look right in the horse's stomach. The goal is to treat those ulcers to get rid of them. However, we know if a horse has developed ulcers, we treat them, and then we take them off medication and keep them doing what they were doing before, the ulcers will return. But it's important to get rid of those ulcers, and the medication that we use is generally the same types of medications that we use in people. The most effective of that is being proton pump inhibitors. And the product that's labeled for use in horses, approved to be safe and effective, is GastroGuard. It is a proton pump inhibitor, and it's very effective in reducing the excessive acid in the horse's stomach to a more normal level, and then the stomach heals itself. The medication does not heal the stomach. The horse's stomach wants to heal itself. By giving the medication, we allow that stomach to come back into a more normal balance with the appropriate levels of acid, and it heals itself. The medication comes in syringes. One syringe is one treatment daily for up to 1,250 pounds a horse, and it's safe for use in foals as young as 4 weeks of age, as well as breeding stallions. Now, I mentioned that if we don't change why the horse got ulcers in the first place, they're going to come back. So in conjunction with treatment, we must focus on how do we prevent them. And that's simply addressing the things that we've already talked about that lead to or predispose the horse to developing them in the first place. So we look at management practices, things like removing or reducing the ulcerogenic factors that we know. So the feeding things and the stressful things that are related, we want to make those as ideal as possible. We know giving more turnout is beneficial. Feeding changes such as changing from cereal-based grain to more appropriate feedstuffs like alfalfa meal or things like rice bran, even beet pulp, which we know are less ulcerogenic but provide equivalent calories, because we don't want to lose those calories. Continuous access to roughage, typically through a slow feeder. This is not free choice so that they can eat quite a bit all at once. But Dr. Cubitt will touch more on that, as well as alfalfa hay. And Dr. Cubitt will discuss that as well. Now, we can also use pharmaceuticals and medication as a prevention. We use a lower dose generally during the high stress times where we know our management and feeding can't overcome those brief periods of increased stress. And then we can also try to use nutraceuticals and supplements. And we would tend to use those most often continuously. But I would suggest that you only use things that have been shown to actually be effective in published research. Because there's a lot of products out there that say they do things without ever having to show that they are effective. And if you spend money on something like that and it doesn't work, it's not necessarily a value, just a cost. So if we look at using medication as a prevention, we also use proton pump inhibitors for that. Again, omeprazole is the drug approved for use in horses. And as a prevention, the product is ALFALFA. Now, because we're using less medication for a prevention dose, one syringe of medication has 4 prevention doses because it's 1/4 of the treatment dose. Right? The syringe is marked that way. So it says dose 1, 2, 3, and 4. And UlcerGuard is labeled for use in horses 6 months of age and older for prevention of gastric ulcers. Now, how we go about using that is a timed method. When the horse is going to be first put under a stress period, or I like to back up a couple days from that and start them on the medication. You remember I said there was 4 doses per tube, so that's 4 days of prevention doses in an UlcerGuard tube. And again, things like traveling, changing facilities, or going to a trainer for a period of time, going to a show. We want to start that a couple days before, and then we maintain them on that same dose throughout that period until they get home. And if it's been a shorter period of time, they can stop the day they get home. If it's been a longer period of time, we might continue that for a few extra days after they get home. But any other things listed on the slide would be an appropriate time to use medication prevention. So the keys for treating effectively gastric ulcers are appropriate diagnosis, and that takes a gastroscope, and then developing an appropriate treatment plan, particularly based on the severity of the ulcers and the location, because that might change the time we're going to treat them for, or the amount of medication, or the different types of medication we're going to give them. We also want to do a recheck afterwards. So if you're concerned that your horse might have ulcers, like quite a number of you were in the poll, I suggest that you talk to your veterinarian so that you can discuss your individual horse's specific issues, and they can help you determine what's going to be the next step for either diagnosing it, or if it's already known, developing an effective treatment plan. So Dr. Cubitt, I think we're back to you.
Thank you, Dr. Cheramie. Excellent information. I think we're going to turn it over to Katie. Oh, nope, she doesn't have a poll question. I thought she had another poll question for you, but we are now going to discuss supportive and preventative management. As you heard Dr. Cheramie say, you can treat the horse for ulcers, you can clear them up medically, but unless you change some of the things in the horse's management environment, they're going to come back. So here are some supportive preventative managements. Well, first thing I want to show you is I want to orient you to a graph. This was some research done by some prominent gastric ulcer researchers in Virginia. And what they did with these horses was put a little probe into the horse's stomach and measured the acidity while the horses were eating free choice hay for 24 hours. What I want to orient you to here is this is the pH here on the left-hand side of the screen, and a pH of 4, anything above that is considered buffered and good. Below that is bad. So for the majority of the time that these horses were eating that free choice hay, their acid was good. What you might notice is towards the end, we start to get some troughs, and that may have been when those horses filled up because they gorged on hay right here. So let's talk about management of the actual forage as well as how much you should be providing. Now, this is the same group of horses, and we, for 24 hours, deprive them of all feed. Still drinking water, and you can see these spikes here when they're drinking water, but we've got no feed. And what I want to point out are some specific points along this timeline. At 1 hour, just 1 hour, the acidity in the stomach is between a 1 and a 2. Now, that's very strong acid. Burn your finger. By 18 hours, these horses had bleeding lesions. But there's a lot going on in between that. By 6 hours of feed deprivation, we already saw some reddening of that stomach lining. What is not uncommon in our management, especially when the weather gets a little cooler and the daylight is shorter, is we're feeding our horses by 5 p.m. in the evening. They're done everything by 7. Now, keep in mind, it can be as short as 30 minutes for everything to be through the stomach. And we're not going out until 7 a.m. the next morning. That could easily be 12 hours of feed deprivation. Now, keep in mind, 6 hours is all it took to get some reddening of that tissue. In reading to prepare for this, horses are pretty smart, and they will start to chew bedding and chew wood because they're trying to produce saliva. But there are some other issues when your horse is eating bedding and chewing wood. So I'm going to turn it over to Katie for a quick poll question.
Thank you, Dr. Cubitt. So our second poll question is, what is the best type of feed or forage for a horse with gastric ulcers? And the options are Timothy grass, oats, alfalfa, or Bermuda grass. Make your best guess if you're not quite sure, and click the submit button. Okay, we have about 75% of you voted. Give you just a few more seconds to finish up before I close the poll. Okay, I think most of you have put in your answers, so I'm going to close the poll. And I know that we mentioned a little bit through the presentation so far. So it looks like most of you are paying attention pretty good, which is good, or you knew in advance, but we had 77% say alfalfa, 13% said Timothy grass, 8% said Bermuda grass, and 3% said oats, Dr. Cubitt.
Excellent. Yes. As we will see from the research that's done, and quite a significant amount of research and good research out of Texas, really looked at alfalfa being one of the keys in management with alfalfa, some supportive management. And the reason is it's really high in calcium. So it's a natural buffer to that stomach acid, like Tums in people. So it's also about the timing of that. And the research in Texas actually compared feeding alfalfa to Bermuda grass hay or coastal Bermuda grass hay. And the alfalfa was much more effective at decreasing the acidity in the stomach than the Bermuda grass hay. If all you have available is Bermuda grass hay, then feed it consistently, feed it continually. But if you have access to alfalfa, that is definitely more effective to put into your feeding plan. And if you think about the graph that I showed you earlier about the timing, maybe the longest period where your horses don't have any protection in their stomach is overnight. So if you go back for a night check, maybe adding your alfalfa at night is ideal, or immediately prior to exercise. Studies show that if you're feeding within 30 minutes to an hour prior to exercise, you can give some instantaneous buffering. If you're just concerned and you're not actively using a medical treatment at that time. So we prefer that you provide alfalfa regularly, 5 to 6 hour intervals. We really don't want that horse standing around a stall not chewing. That saliva production, as we mentioned before, helps to buffer that stomach acid. And the horse's digestive system is still designed, it still functions as if the horse is standing out in a field grazing continually all day long. The horse's digestive system has not evolved or changed to account for how we manage them. So they're continually producing that acid. So we need to be continually buffering it. What does that mean with the amount of forage that we need to be feeding? I think you all should be pretty familiar with this, but an absolute bare minimum of forage, hay, pasture is at least 1% of body weight. I really never go that low. Even if I have a horse on a weight loss program, I'm only going to be around 1.2% of body weight. I generally recommend for the majority of our performance horses 1.5 to 2.5% of body weight. Now that doesn't all have to come from alfalfa, obviously, but if you're adding alfalfa in, that can be ideal. So I think we've nailed down the type of forage to add into the diet. Now it comes to the management of actually feeding that. We want to make sure that we are mimicking that grazing behavior. Because if you go back to the graph that I showed you of the horses with ad-lib access to forage for 24 hours, you still noted there was some troughs in acid production. There was really some low points in the acid, and you would think, well, they had access to hay 24 hours. Why did it drop down? Because if we're also meal feeding hay, those horses eat a lot at one point and then they're full and they stand around until they're not full. And so that acid can build up and build up. So we really want to slow down their rate of intake and mimic grazing behavior. And there are so many different tools out there for doing this. You know, there's a whole slew of different slow feed hay nets. My preference is any of the options that can be closer to the ground. As I mentioned earlier, if you keep the horse's head closer to the ground, it's got other benefits and it's going to slow down rate of intake as well. But if you go online, you can Pinterest your heart's content 1,001 different options for slow feeders. But really the goal is slowing down rate of intake and mimicking grazing behavior. The other option that a lot of people don't think about, they only think about this when their horse is out at pasture, is a grazing muzzle. Let's just say we're using one of these slow feeder options, but my horse is still eating it really quickly and I work, so I can't be going out there 5 times a day to give him more hay. Don't be afraid to put a grazing muzzle on your horse as well as a slow feeder to even further slow down his rate of intake, to get him to be consuming that forage continually. Goal here, we want to decrease stress and we want we didn't eating grains or concentrate.
Dr. Cubitt, if you would hold just for a second, I think we're having some sound difficulties. I just want to check. I know we've been having some sound cut out. Can everybody hear me okay right now? Go ahead and just chat in the questions pane if you can hear me. Hi, Dr. Cubitt?
Perfect. Yes, I'm here.
Okay, you're back. Can everybody else hear me? Attendees? Okay, good.
So I'm not quite sure where we missed, where my sound cut out, but I was just going through kind of summarizing, but let's turn it over to questions so that we don't waste any more time.
Perfect. Sorry about that, everyone, but we will go ahead and skip over to some questions. So feel free to jump in there. So thank you both, Dr. Cubitt and Dr. Cheramie. You provided some really great insight into what causes gastric ulcers for us, how to care for them, and preventative strategies. So just a quick reminder before we jump into the questions, please download the nutritional paper and quick fact sheet available under handouts before we end the webinar. We will also be drawing our winner, actually 2 winners today, for free Standlee product coupons and Ulcer Guard following the Q&A session, so stick with us. And we're going to go ahead and get started on the questions. So again, please submit questions through the questions pane in your attendee control panel if you'd like. And if you could mention which presenter you'd like to direct the question to as well. So our first poll question, and some of these I know that either Dr. Cubitt and or Dr. Cheramie will both be able to address this. So if either of you want to start the question and somebody else want to fill in, please feel free to do so. So our first question is, Can ulcers resolve themselves by allowing horses to live naturally, grazing in a herd and the like?
I'll take
I'm going
that
to
one.
turn that over to Hoyt.
So we actually do know that if we put a horse out in a natural grazing setting and let their stomach kind of rebalance into that setting, over time, the ulcers, for the most part, will heal. If they're very severe, they may not heal completely. But we know that that is a feasible plan for some horses. It may take several months. It can take upwards of a year in certain cases. But remember, like I said, the stomach wants to heal itself if we put it back in that natural balance between buffering and acid level and keeping the fill up so that the stomach doesn't collapse.
Perfect. Thank you, Dr. Cheramie. Let's go to our second question. It looks like Marcy had a couple of questions. Is Ultium okay to feed a horse with gastric ulcers? And is Outlast a good supplement for horses with gastric ulcers?
Dr. Cheramie, I can touch on the Ultium. How about you touch on the supplement? So really with any grain concentrate that you're feeding, the Ultium is higher in fat, but it really comes down also to the management of how you're feeding it. If you're feeding larger quantities of it, upwards of say 8 to 12 pounds, you need to make sure that you are feeding that in small meals frequently. It isn't super low in sugars and starches, but you need to make sure it's the management. Feed it in small meals frequently. If you have a horse with gastric ulcers that you are feeding a lot of concentrate to for maybe weight gain, for example. Dr. Cheramie, I will let you touch on Outlast.
Katie, can you tell me the name of the supplement again? I missed it with some of the sound issues.
Yes. So Marcy was asking about Outlast, the supplement Outlast.
Okay. So Marcy, I'm sorry, I'm not personally familiar with that particular supplement. But again, like I mentioned, the way we look at supplements is to determine what is the active ingredient. What are they trying to do? Or are they simply an antacid? Or do they have other components that might help cells heal better? And determine if that's an appropriate way to address it. I can tell you there's some studies done on certain supplements and ingredients that had no significant effect, like aloe vera on horses. But there are some supplements, just a few of them, that have had some published data that supports they may be beneficial as part of an overall management program. No supplements on the market have ever been shown to heal ulcers or to prevent them by themselves completely in any study. So it's a combination of knowing what you have, knowing what you expect it to be able to do, and then using it to the best of its ability to get that done.
Perfect. Thank you, Dr. Cubitt and Dr. Cheramie, for kind of tag teaming those questions there. Our next question is from Mary, and her question is, what is best daily nutraceutical to prevent ulcers?
So again, that kind of goes back to what we just talked about. There is none on the market that I've seen any scientific data that says in and of itself, by itself, in a highly ulcerogenic environment, is going to be completely effective in preventing ulcers. There are some on the market, like I said, that in conjunction with an appropriate program, they can be beneficial as a part of that overall management.
And to be honest, if you start as a manufacturer, if a supplement manufacturer is saying they can cure ulcers, then their supplement is no longer a nutraceutical or a supplement. It becomes a drug if you're making claims like that. And as Dr. Cheramie has outlined, GastroGuard and UlcerGuard are the only approved drugs, true drugs, for the treatment of gastric ulcers. Now, there are gastric support, but anything that's got calcium in it is going to work the same as alfalfa. Magnesium has some slight buffering as well, but alfalfa, not only does it give you the calcium that's going to help buffer that stomach acid, but it's also a very highly digestible fiber source. It gives you good quality protein. It feeds the bacteria in the hindgut. The horse has to chew it, so they're producing saliva. So for me, a natural ingredient like alfalfa is a good all-round, you could call it even a nutraceutical, because you get so much more from it than just a small amount of buffering, some buffering capacity. And it's, from the research done in Texas, it's a significant amount of buffering capacity.
Perfect, thank you. And I know we're close to time, but just due to the sound issues, I want to try to get at least one or two more questions in. So Danielle is wondering, are there points on a horse we can palpate that may show us that a horse may have ulcers before we go to the vet for a scope?
Are you talking about acupressure points? I'm guessing. Dr. Cheramie, you may be able to touch on that. Even if you have acupressure points, which I have spoken with a lot of veterinarians, said that they can, but it's never going to give you the severity of those ulcers. The only thing, to my knowledge, is a gastroscopy. Dr. Cheramie?
Yes, that's right, Dr. Cubitt. Acupressure points, or those points can lead us to believe that a horse might have ulcers. There's some work that we're trying to do to actually look at the association of saying a horse that's positive at certain points. Does it correlate to the presence? In a lot of clinicians' hands, they see that when they do it themselves, so it's fairly anecdotal. But I know there's a couple of research projects that are trying to get underway to determine that. As Dr. Cubitt mentioned, though, it can't tell you where they are, which type of tissue they're affecting in the stomach, and the severity. And so that goes to treatment. And what I tell people is, if you don't have access to a gastroscope, treatment because you think the horse has ulcers, that's okay, but it's not great. Because remember, 1 out of 3 horses won't have ulcers. And if you treat for a month, it's not inexpensive. So it's ideal to try to determine the true presence of the ulcers, what part of the stomach lining they affect, and the severity to get the best treatment plan. It provides the greatest value to both the horse owner and the horse.
Dr. Cheramie, I have a quick question, Katie, if you'll indulge me. How long should a horse be on GastroGuard? How long is a treatment plan? Is there an end point where you say the horse should not be on this any longer and should transition to say, UlcerGuard? What is the length of time for GastroGuard?
So for treatment, we're using that dose. And for me, it is based on the severity of the ulcers. The label will say treat for 28 days. But in less severe cases, they may heal quite a bit before that. In very severe cases, it may take 6 weeks to 8 weeks to actually completely heal them. So as long as there's ulcers, we want to use the treatment dose if the end game is to actually get rid of the ulcer. We know from our studies that lower doses don't effectively heal the ulcer as well. They're good at preventing a horse that doesn't have ulcers from coming back, but to get them to heal, we need that high dose. We also get the question that's kind of associated with this as well. Can I give my horse that medication for too long? Because we know there are some potential side effects in people. There's a couple studies that have been published that looked at outside of the work that BI has done in the past by independent researchers that has looked at that in horses, and we don't tend to see those effects. We get the question that if we're taking away the acid, can the horse still digest the food properly? And remember, I mentioned that the horse doesn't need a very high level of acid. We don't get rid of all the acid when we treat them, We just try to balance it back to that normal level so that the horse can heal itself. We really haven't had any reports that we can determine of those kinds of adverse events that are being reported in people. They just haven't come to light in the horse. So I just want to make that comment.
Perfect, thank you. So we're over time, but I want to thank Dr. Cubitt and Dr. Cheramie both for being on here and presenting this for us today. And thank you to everyone for attending today's webinar. We really appreciate your time and interest in wanting to learn more about nutrition for your animals. I know that there were actually a number of questions that came in that didn't get answered, so please reach out to us. We will have some contact information at the end that you can get a hold of us, and we'll answer those questions for you. But before we wrap up, I do want to go ahead and announce our 2 winners of free Standlee product coupons, and each winner will also get 2 tubes of Ulcer Guard. So the winners are Mary Osgood and Leslie Newman. So congratulations to both of you. Thank you so much for jumping on and engaging with us today on the webinar. We will email you to get mailing information for sending out your giveaway items. If you have any other questions, like I mentioned, please contact Standlee's customer relations team. The phone number and email are available on this final slide. Dr. Cubitt, if you wouldn't mind just skipping forward to that. You can also find past webinars, more nutritional white papers, and other great information, including the Standlee Barn Bulletin blog, and some great tools to help identify what type of forage is best for your horse and how to optimize their diet on our website at standleeforage.com. When you leave today's webinar, you will receive a survey on the presentation, and we would appreciate it if you could complete that for us. Your feedback really helps us to create better webinars, and it also helps us to identify some great topics for future webinars that we will be hosting later this year. You will also receive a follow-up email within probably about 24 to 48 hours that has a link to view a recording of today's webinar if you'd like to go back and reference it. The recording should be available for a week following today's webinar and then available on our website under Nutritional Resources. So on behalf of Standlee Premium Western Forage, Dr. Cubitt and Dr. Cheramie, thank you so much for joining us for this webinar, and we hope you have a great rest of your week.